Good morning. My group decided to discuss about medical errors. My group mates are Maggie Bell Ruales, Cherry Ann Queda, Trisha Nicole Cabase, and me, Sarah Angeli R. Cuerdo. What do we mean by medical error? Medical errors are any avoidable event that may cause or lead to incorrect medication use that may cause harm to the patient. Here is the scenario. You are having your 3-month follow-up with the implementation of your EHR system with the clinical educators at local university hospital. You have together discovered that there has been an increased documented medication administration errors. Both parties have concerns, and the educators have asked you to go back to the drawing board to revamp your EMR software. You will then present your EMR system to the educators and then to the nursing staff. There are 6 causes of medical errors according to CARE. The first cause is poor communication. Medical professionals work in teams. Nurses, doctors, surgeons, specialists, clinicians, and administrators must work in tandem to provide quality care. If a nurse fails to properly monitor a patient or a doctor doesn't convey important diagnostic information to the necessary team members, medical errors can occur. The second cause is information transfer breakdowns. Patients must sometimes travel between different medical facilities, practices, and surgical centers to receive care. When they do, files must go with them. If one office sends an incomplete or inaccurate record to one another, it can easily interfere with patient care and lead to a medical error. Human error. Medical professionals have a greater duty of care than most people in other professions, and they receive extensive education and training before administering care to patients. However, this does not mean that they never make mistakes. Simple human error can lead to surgical mistake, compromised lab samples, poor documentation, illegible handwriting on a prescription, and more possibilities. Patient-related problems. Some medical error occur due to miscommunication or other problems with the patient. The most common example of this type of error is the failure to second or secure informed consent. Patients have a right to know all the possible risks of any proposed course of treatment, and doctors must ensure their patients fully understand a treatment option before commencing it. Next is organizational transfer of knowledge. Medical errors can also happen when a healthcare organization fails to uphold proper training and educational protocols, particularly in organizations that hire temporary staff. Lastly, equipment failures. Modern medicine relies heavily on many complex instruments and machines. If a medical device, surgical tool, or piece of lab equipment breaks, it can lead to a medical error and harm to patients. Liability for an equipment failure may rest with the medical personnel using the equipment or the manufacturer of a defective device.
The adverse effect on medication errors. Pregnancy-related medication mistakes can have a significant impact on the growing fetus and may result in birth abnormalities. There are several drugs that are known to be teratogenic, which means they can damage the growing fetus and cause congenital defect. Serious drugs error have the potential to cause impairments and long-term health issues. For instance, Taking the wrong prescription or dose could result in neurologic impairment, organ damage, or other problems that leaves a person permanently disabled. Hospitalization may be required because of medication errors for several reasons, such as necessity to manage a complication, handle adverse response, or offer immediate medical attention to lessen the impact of the error. In the most severe cases, medication error can lead to patient fatality. This might occur due to administering the wrong medication and incorrect dosage, or other critical errors that compromise the patient's health.
Implementing strategies in an electronic medical record or EMR system to prevent medication errors involves several key steps. First, ensure robust system customization to match your healthcare facilities workflow. Regularly update and maintain the medication database to reflect the latest information. Train healthcare staff on proper use of the EMR system and emphasize the importance of accurate medication entry. Implement user-specific permissions to restrict access to sensitive information and prevent unauthorized changes. Encourage the use of barcode scanning for medication administration to verify patient and medication details. Verify orders, verify high alert medications with another nurse because those have a propensity to cause serious patient harm when used in error. Foster a culture of open communication regarding medication error, encouraging reporting without fear of punishment. Continuous monitoring, feedback, and improvement are essential components of a successful strategy.
Electronic health record system manages health-related information and reporting for patients' data, and it also enables nurses to provide the right care at the right time. AHR system simplifies the process of gathering, documenting, analyzing, and reporting the medical data of patients digitally. It is also a very essential element in healthcare as it offers novel, prompt, and digitalized solution for medical care of patients. It also helps in alleviating hassles for nurses to go through with manual administrative processes in healthcare. These are the following advantages of AHR system. First, it's very timely for medication administration, reduced medical errors, and safer care. It has quick access to the health records for coordinated care, safer and reliable prescribing, privacy and security of patients' medical data, space, time, effort, and cost saving. It is also accurate, up-to-date information at the point of care. There is quick access to health records of efficient student care and legible complete student health documentation.